Hello, everyone, and welcome to another episode of Mental Health Talk. Again, my name is Dr. Lola, and the purpose of this channel is for mental health education. Today, I would like to talk about alcohol use disorder. What is alcohol use disorder? For most adults, moderate alcohol use is probably not harmful. However, about 80 million adult Americans have an alcohol use disorder. This means that their drinking causes distress and harm. Alcohol use disorder can range from mild to severe, depending on the symptoms. Severe alcohol use disorder is sometimes called alcoholism or alcohol dependence. Alcohol use disorder is a disease that causes craving, a strong need to drink, loss of control, not being able to stop drinking once you started, negative emotional state, feeling anxious and irritated when you are not drinking. What is binge drinking? Binge drinking is drinking so much at once that your blood alcohol concentration (BAC) level is 0.08% or more. For a man, this usually happens after having 5 or more drinks within a few hours. For a woman, it is affected after 4 or more drinks within a few hours. Not everyone who binge drinks has an alcohol use disorder, but they are at higher risk for getting one. So please, it's very important to watch your alcohol intake. Um, Drinking occasionally on the weekend might be okay, but drinking every day and drinking so much every day is a cause for concern. What are the dangers of too much alcohol? Too much alcohol is dangerous. Heavy drinking can increase the risk of certain cancers. It may lead to liver disease, such as fatty liver disease and cirrhosis. It can also cause damage to the brain and other organs. Drinking during pregnancy can harm your baby. Alcohol also increases the risk of death from car crashes, injury, homicide, and suicide. How do I know if I have an alcohol use disorder? You may have an alcohol use disorder if you can answer yes to 2 or more of these questions. In the past year, have you ended up drinking more or for a longer period than you have planned to? Wanted to cut down or stop drinking or tried to but couldn't? Spent a lot of time drinking or recovering from drinking? Felt a strong need to drink? Found that drinking or being sick from drinking often interfered with your family life, job, or school? Kept drinking even though it was causing trouble with your family or friends? Giving up or cut back on activities that you enjoy just so you could drink? Gotten into dangerous situations while drinking or having drinking? Some examples are driving drunk and having unsafe sex. Kept drinking even though it was making you feel depressed or anxious, or when it was adding to another health problem. Had to drink more and more to feel the effect of the alcohol, which we call tolerance, or a beginning of dependence. Had withdrawal symptoms when the alcohol was wearing off, which includes trouble sleeping, shakiness, irritability, anxiety, depression, restlessness, nausea, sweating. In severe cases, you could have a fever, seizures, or hallucination. What should you do if you think you might have an alcohol use disorder? If you think you might have an alcohol use disorder, see your healthcare provider for an evaluation. Your provider can help make a treatment plan, prescribe medication, and if needed, give you treatment referrals. If you try to quit on your own and you've been binge drinking a lot, you might develop what is called delirium tremens, which we would talk about, and the after effects of that can be life-threatening. So you might not be able to do it on your own. You might have to go in to the hospital to help you get detox. So symptoms of alcohol use disorder are numerous. Again, we mentioned the seizures, the anxiety, the depression. Again, it wasn't depression. I've seen a lot of some patients that would come in and would be concerned about the antidepressants and why it's not working. Alcohol is also a depressant, so it will interfere with the chemical balance in your brain. So this will make you more depressed, even if you are taking the antidepressants, it will not work. So it's very important to be mindful of these things. One second. All right. Why is it being able to hold your liquor a concern? For some people who drink, it takes quite a few drinks to get a buzz or feel relaxed, and they may feel less likely to show signs of intoxication compared to others. This is sometimes called being able to hold your liquor or drinks someone under the table. Often, these individuals are unaware that their body's lower response to the intoxicating effect of the alcohol isn't protection from alcohol problems, but instead is a reason for caution. So there will be some people will start saying things like, "Oh, I can hold my liquor. I can hold my liquor." That means you are building tolerance to the alcohol. You've been consuming more and more, and your body has now been able to tolerate it more. So you are now more dependent on it. You need is a reason for caution. It's not something to boast about. These individuals tend to drink more, socialize with people who drink a lot, and develop a tolerance to the alcohol. It takes more and more alcohol to feel or act intoxicated. As a result, they have an increased risk for developing what we call alcohol use disorder. Someone who misuses alcohol, especially over the long term, can experience permanent liver damage, heart or brain damage, and all people who drink, regardless of the amount, need to be aware that critical decision-making abilities and driving-related skills are already diminished long before a person shows physical signs of intoxication. So please be aware of this, the impact it has on your family members, the impact it has on your friends and your loved ones. Why do women face higher risks for alcohol-related consequences? A growing body of evidence indicates that women who drink at increased susceptibility to short and long-term alcohol-related consequences. They can experience things like liver disease, cardiovascular disease, neurotoxicity, and alcohol-related memory blackout compared to men. One reason for this is that alcohol resides predominantly in body water and pound for pound. Women have less water in their bodies than men. This means that after a woman and a man of the same weight drink the same amount of alcohol, the woman's BAC, blood alcohol concentration, will tend to be higher, putting her at a greater risk for harm. Other biological differences may contribute as well. While alcohol misuse by anyone presents a serious public health concern, women face alcohol-related problems sooner and at a lower drinking levels than men. Women who drink are also at a greater risk for developing breast cancer than women who do not consume alcohol. So please be mindful. What medications interact harmfully with alcohol? Again, some medication that you might never have suspected can react with alcohol, including many over-the-counter medication without prescription. Even some of the herbal remedies don't mix well with alcohol. So just be very careful. Almost everything interacts negatively with alcohol and is also a depressant. So imagine taking alcohol with any anxiolytic medication, things like Activan, Xanax, Klonopin, or even any antidepressant. It will further depress your respiratory system, and it can be life-threatening. So please be mindful. Um, can I do anything to protect my liver from the effect of too much alcohol? There is no scientific evidence that anything will prevent liver damage from too much alcohol. Liver damage from alcohol misuse happens in stages. Some relatively mild damage may happen after a single binge drinking episode, but this reverses itself if the heavy alcohol use stops. So there is hope. Once you are able to stop with the help of your family members, support system, the adverse effect reverses itself. So thank God for that. If heavy drinking continues, however, liver damage can progress to several more advanced stages, including cirrhosis. Reversal of liver damage becomes much more difficult, if not impossible. In advanced stages, the only treatment is liver transplant. The best way to avoid damaging your liver is not by misusing alcohol. If you choose to drink, If you already have liver damage, stopping drinking could prevent progression to more serious liver disease. Even if the standard recommended dose of acetaminophen can increase the risk of liver damage, particularly among those who drink heavily. So again, people that drink heavily should be mindful of things like Tylenol that can, definitely hurt their liver even further. I am considering cutting down or quitting drinking. How do I begin? The first step, of course, is to decide whether cutting down or quitting is best for you. Think about your family. Think about yourself, your long-term goals, your short-term goals. Think about your loved ones, what your behavior is doing to others. See this consideration and discuss different options with a different healthcare professional, a friend or someone else you trust. Thinking about cutting down, there are several tips that can help you to cut down. Again, behavioral therapy, cognitive therapy are one. So, anyone who is cutting back or quitting drinking is likely to be offered a drink at times when it's unwanted. So, you want to rethink this and build resistance skills that will help you to stay in control. You will learn how to recognize this type of pressure to drink, avoid the pressure, and cope with situations you can't avoid. Again, sometimes it's also helpful to stay away from familiar places and things, people that would encourage you to keep drinking. You want to keep your distance if you know you have struggled with an alcohol use disorder, and staying around such people would make you drink more. The treatment that are available for someone with an alcohol problem, people commonly think of 12-step program, 28-day inpatient rehab as the only option, but other options are available. Speak to your healthcare provider. Cognitive therapy might help. There are different support strategies for quitting. We talked about medications, behavioral therapy, mutual support groups are available to help quit drinking. Again, don't give up. Changing habits such as smoking, overeating, or drinking too much can take a lot of effort, and you may not succeed with the first try. Setbacks are common, but you can learn more each time. Each try brings you closer to your goal. Whatever course you choose, give it a fair trial. If one approach doesn't work, try something else. If a setback happens, get back on track as quickly as possible. In the long run, your chances for success are good. Research shows that most people who have heavy alcohol use, even those with alcohol use disorder, can either cut back significantly or quit. So there is hope. The point is, do not give up on yourself. Do not feel as a failure. Do not feel the need that you cannot ask others for help. Everyone needs help at some point or another. That we need each other. You need good family support. You need your good friends that are positive influences. Ever be self-aware. What friends are contributing to your excessive drinking or promoting the bad behavior? Just be mindful. If you are consuming too much and it's starting to affect your physiological health, be mindful of things like this and consider quitting and changing. Social support. Again, one potential challenge when people stop drinking is rebuilding a life without alcohol. It may be important to educate your family and friends that, okay, please, I'm trying to quit. Do not offer me alcohol. And don't make jokes like, oh, so you can't hold your liquor and things like that. People, just be mindful. This individual is trying to quit and they're working on recovery. Develop new interests and social groups. People that can encourage you, be your church members, be it any positive social support system. Find rewarding ways to spend your time that don't involve alcohol. Pick up new hobbies. Read a book. Read your Bible. Do something positive that will help to build your life up. Ask for help from others. When asking for support from friends or significant others, be specific. This could include not offering you alcohol. It's okay to say, please don't ever offer me alcohol again. I'm working on myself. I'm working on my recovery. Not using alcohol around you. You might also say, please do not use alcohol around me. I really appreciate that. Giving words of support and withholding criticism. That's not the time to be making fun and sarcastic gestures. Not asking you to take on new demands right now. Because again, that person might be overwhelmed. That might be their coping skills. How are you contributing to their health? Are you making sarcastic comment? Are you demeaning? Are you condescending? These are things family members need to be more aware of as well. That would not make their family members go the wrong path. You want to be as supportive as possible. You want to show love. You want to show support. Again, and also support groups as well. Well, I hope this has been helpful. And if you like topics like this that impact mental health, families, friends, loved ones, please subscribe to our channel. If you would like to see more topics like this or areas that you would love for us to cover, leave your comment below as well. Subscribe. Thank you for watching, and I look forward to the next mental health episode with you. Have a blessed day. Thank you.